Thinking about how to get us ready for the task we have today in this workshop of figuring out how to create an environment that's better for local food production, I thought I'd address two different issues for planners. One is, well, why focus on food? And a little bit about what is it that planners can do. Interesting reformatting coming up in the computer. Well, why focus on food? And I think it might be useful to step way back and say, well, cities and food evolved together. That in fact, you can tell my professor going way back to, urban revolution and agricultural revolution occurred together, and without one, there would not have been the other. So we're talking about the Tigris and Euphrates River and the development of early cities. And as we look at the development of cities were shaped very much by food. Carolyn Steele had this nice piece about how the city of London was shaped by food, by where food came from. That as food came into the city, certain parts of the city would be associated with cattle, with poultry, and depending on where it was produced, you'd see areas of the city that were focused on that. And in fact, even thinking about urban economics and the location of economic activities, some of the early thinking really came from agriculture, and that certain kind of activities would take place really very close in the cities. So milk production, dairy production, and horticulture very far in, with livestock very far out, and that producers would sort of sort themselves relative to the city, that it was shaped by the city, that there was a strong relationship there. And it's easy to imagine that the city, its character, is really tied to food. The joy, the wonder of the city, the smells of the city, the things that make it wonderful, the things that attract tourists to the city, they are very, very well, strongly tied together. Well, why else should we be focusing on food? And as planners, we're very quick, I think, to think about cities and what's going on in cities. But I think it's important to think about those vast regions that are not urban, but are really shaped by cities, the vast parts of land that are used for industrial agriculture in order to feed cities. And remember, populations dependent on carrying capacity. That is dependent on how much food is produced and where it's produced. And with the Industrial Revolution and with changes in the 1900s, it's just absolutely been amazing what's happened in food production. The Haber-Bosch process, allowing isolation of nitrogen fertilizers, of traction power used to plow, a real focus on crops that have high yields, and the Green Revolution, really a planned effort to eliminate hunger worldwide. And all of these things make a huge difference, and have led to population increase and led to increase in urbanization of the world. But what's happening in these areas comes with some costs. That industrial food production can be very resource intensive in some important ways. It uses a lot of water. It uses a lot of energy to produce calories of food. That often industrial agriculture is based on monocultures, on growing one thing very well again and again and again, and what happens to other types of cultures. There's deforestation, pesticide use, and social costs of destruction of family farms and culture that may take place in rural areas. So industrial agriculture creates some changes, and what happens, and cities are part of that. It demands food production, and things are changed. And similar things happen in animal food production as well, where it becomes more intensive and standardized feedlots and so forth. And that also has costs. where biosolids are produced more than land can handle, and it's very concentrated. Groundwater contamination, nutrient runoff, drug resistance issues, greenhouse gases created. So, why should we be focusing on agriculture as planners as we think about land use and land use over time? Foley has created this little model of, over time, what land use might look like, moving from natural ecosystems to sort of a modern condition where a lot of it is intensive agriculture, an urbanized area, perhaps some protected land, but very little in the subsistence agriculture and small-scale farms. And in the future, is this where we want to be? Is there a role for small-scale farms? Is there a role in urban areas for farming? What do things going to look like? We know that there are certain costs that come with these vast areas involved in industrial agriculture. But why focus on food as planners help? That as planners, our very profession comes out of a mandate to protect the health, safety, and welfare of the population. And if we look at the 1800s and cities and the times when the planning profession and related professions were being created in one form or another, we had cities of a mean coming together and not really certain that people could live together in that huge, very high density in healthy ways. Cholera epidemics, all sorts of other issues. And what happened? Well, there were professionals coming together, trying to figure out ways to shape their urban environment to deal with health issues. So how to prevent disease? Well, by creating access to light and fresh air, creating parklands, town site consciousness, housing designs that created access to light and air, sewer systems to carry away infecting agents and so forth. But at this period, in the 1800s, we didn't have germ theory. We really didn't know. We had very bad theory about how to prevent infectious disease. But at the same time, somehow there were tremendous changes with strong urbanization, what we did and how we reacted to things. So our profession comes out of trying to improve health in some crisis situations. Well, so where are we on health and what needs to be done around food? Well, we can think about how food has issues around adulteration of food. This is a graph from 1800s, early 1900s, sort of looking at how when urban food production is taking place, all of a sudden you didn't know who was producing your food, you didn't know where it was coming from. And there could be food adulteration. It might be less nutritious than it might otherwise be, that there was a need for regulation and to figure out how to make sure that food was nutritious. And the possibilities for contamination, of growth hormones, of pesticides, which I've already talked about, of pathogens. What happens when one infected animal is ground up with hundreds of others and spread around it very quickly? There can be a difficulty of pathogens being spread around. There can be contamination. So issues that we care about as planners. But as Sheila has addressed, we also as planners have a commitment to issues of equity. AICP, American Institute of Certified Planners, ethics guidelines and so forth, that we care about equity issues. And there are many health disparities, and a number of them can be tied to food. That supermarkets are less likely to be available in African American communities than others. Access to transportation can be lower in low-income households. That the quality of food is often less in lower-income communities, whereas the cost is often higher in these small neighborhood producers. And there's some evidence that even fast food may be more available in lower-income communities. Others say it's about the same. But there are definitely issues around food and health disparities that we need to turn to. But there's one other really really big one that we need to look at, and that is the issue of obesity. That, just as I said, in the 1800s with cholera and many people coming together, not really knowing much about disease theory, but knowing that there was a problem to be solved, a lot happened: townsite consciousness, sewers, and so forth. Well, what's the story now in the United States? One of the major health issues, obesity. I don't know how many of you have seen this Centers for Disease Control data on obesity trends, but this shows essentially the percentage in each state that is obese, that is, has a body mass index of over 30, or 30 pounds overweight for a 5'4" person. And you can see, well, there is Illinois, looks like less than 10%. And as we go to 1986, a little bit more, definitely something going on here. We need a new color. It's from the 15 to 19%. It just doesn't turn around. Dark blue everywhere. A new color in Indiana, our neighbor, shows up